Hi there. My name is David Lim, and I am a surgical resident at the University of Alberta, and I'll be talking to you today about my project, How Do Students Use Written Language to Say What They See? A framework to understand medical students' written feedback about their teachers. To begin, my co-authors and I have no disclosures to declare. Now, little is known about the value of the feedback that medical students are traditionally asked to provide at the end of a teaching encounter. Some have argued for its utility in improving teaching performance. For example, in 2007, Van Wyck, in a survey to medical facilitators, found that most believe that written comments are an important source of formative feedback, especially when they were qualitative comments, and especially when they were completed by students thoughtfully. On the flip side, some have argued that they are not useful in helping to improve teaching performance. In 2011, Myers said that the current state of medical student feedback was too subjective and not useful, and asked that a formulaic approach be developed. And Van Wyck further added that providing written comments alone to teachers is insufficient at improving teaching performance, and that teachers have to engage in active feedback guided critical reflection in order to improve their teaching behaviors. So the aim of our study is to examine the written comments that medical students provide as feedback at the end of their surgical clerkship in order to determine how they view their teachers in terms of teaching performance and behaviors. Our secondary objective is to help future medical students provide higher quality and more specific feedback to their educators. A short primer about surgical education at our institution, the University of Alberta in Edmonton, Canada. We have about 600 medical students enrolled in our medical program, and 12 weeks out of the 4-year medical program is devoted to the teaching of surgery. 150 surgeons are involved in the teaching of surgery, and this teaching is provided to about 300 students per year, divided between the clerkships in general surgery and subspecialty surgery. Now, at the end of each clerkship, students do provide numerical ratings and written comments online. Now, the prompt for the written comments is simple and non-directive. It simply asks for student comments. Now, after obtaining ethics approval, we looked at all written comments that were obtained from medical students in the 2 surgery clerkships between 2009 and 2011, and all data was anonymized, and we excluded members of the study team. And this was a qualitative study using a grounded theory approach. So what we did was we first began with iterative reading through all the comments and open coding. And then we subsequently looked at our open coding and applied analytical coding to identify recurring themes. And then the study team met together to generate a framework that captured all variations in the data. And as far as possible, we identified domains and subdomains in the recurring themes, and these were named using direct quotations. And we continued generating domains and subdomains until data saturation and there was no new emergence of new domains. And these are our results. So the framework generated had 3 key domains, and they were the following: physician as teacher, physician as person, and physician as physician. And we'll take a look at each one more closely. Now, regarding the physician as teacher domain, students first commented on acts of teaching. So they commented on things like content and its utility. So here's an example of a quotation from one student looking at a positive. So-and-so taught me many things, including histories, physical exams, and surgical skills. And then a negative comment would be, Dr. X had a tendency to ask obscure questions rather than core knowledge. They also commented on asking questions, explaining concepts. For example, he explained things in detail whenever I had questions and was always willing to discuss with me things that I had read. And on the flip side, they would comment on the negative side of not explaining concepts. For example, the only concern I had was that she just told me to look it up when I asked her a question. Other acts of teaching that students commented on were stimulating discussion, involving students, finding opportunities, finding time, whether they were active or they were passive, and providing feedback. For example, he is quite outspoken about one's strengths and weaknesses, providing rather helpful feedback, especially at such an early stage in clerkship. And then on the flip side, I would have liked to have received more feedback from him throughout the rotation. When I asked for feedback, I was simply told that I'm doing fine. Now, from these acts of teaching, students were able to infer an educator's beliefs and values about teaching, and this is the second subdomain that student comments related to. So they commented on whether a surgeon was passionate about teaching. So for example, Dr. X obviously cares about the education of students and residents. He explained everything in detail in the operating room, along with the evidence behind it, and even gave us many teaching sessions during rounds. Or not having a passion for teaching. Dr. X is a great surgeon, but has no interest in students learning. It would have been nice if he had been a little more enthusiastic about teaching. He also commented on whether a teacher was learning focused, learner focused. So here an example of learning focused, Dr. X was very interested in helping me to learn. I was encouraged to learn about the conditions I was seeing and to reflect about the way I presented information, dictated, and the reasons behind investigations ordered. Or on the negative side, however, I did not feel he encouraged me to learn, nor did he do a lot of teaching himself. He asked few questions, gave few opportunities for discussion, and allowed me to do very little in the operating room. So as you can see, using the acts of teaching in the first subdomain that students commented on, they are able to infer beliefs and values about teaching, such as passion. And they also commented on whether the educator was supportive or whether they were motivating. Now, the second domain that was identified was physician as a person. And the student comments in this domain relate to personality traits of the surgeon. So whether they were kind, caring, or relaxed. So for example, looking at the relaxed subdomain, a positive would be Dr. X was very cool and collected under all circumstances. And then on the negative side, swings and disposition were a little too tough to handle at times. Where they were approachable, Dr. X does not get frustrated when medical students ask questions, which was much appreciated. Or however, she was intimidating as a preceptor and I never felt at ease or myself around her. They also commented on things like patience, being respectful, self-awareness, charisma, and honesty. And finally, students also commented on the domain of physician as physician. And in this domain, students commented on elements of physicianship. So the relationship that the physician had with patients. So for example, I found Dr. X had great empathy and communication, and I will be modeling my own interaction after Dr. X. A negative would be, did not always spend enough time with patients or address all their concerns. They commented on the relationship between the physician and the healthcare team. For example, he gets along well with the nurses and residents, or his attitude towards other healthcare professionals was at times abrasive and borderline abusive. They also commented on expertise, professionalism, and role modeling. So what our framework that we have generated has shown is that students comment on 3 key domains regarding their surgical educators. Not surprisingly, when we ask for them to provide feedback on their teachers, they will comment on elements of teaching. And first, they comment on acts of teaching. And from these acts of teaching, they infer and comment on the beliefs and values that they feel the surgeon has towards teaching. But in addition to comments on teaching performance, they also comment on personality traits and elements of physicianship. This shows that students don't necessarily see their surgical educator as simply in the teaching domain, but as an integrated role as both teacher, as a physician, and also as a person. Developing this kind of framework has helped us identify domains that we could use specifically to elicit higher quality feedback from medical students in the future. By asking students to comment on these key domains, then we can be more specific about the kind of feedback we would like to have in return And in addition, we may be able to provide higher quality feedback to surgeons and educators that might help them improve their teaching. It's interesting to compare this kind of framework with other frameworks in the literature. For example, one that is well known in Canada is our CanMEDS framework, developed by the Royal College of Physicians and Surgeons of Canada. Now, the physician as teacher domain that we have identified corresponds with the scholar role in CanMEDS, although it's much more elaborated on in our study. There is not quite a correlate for the physician as person domain, and the physician as physician domain relates to multiple aspects of the CanMEDS domains. For example, professional, communicator, collaborator, manager, medical expert. In a previous study looking at family medicine residents and how they commented on their teachers, Yulian et al. Also generated a similar framework with similar domains such as teacher, person, and physician, and they also identified a fourth domain, supervisor. And in a previous study, we looked at the comments that surgeons provide about medical students and in their feedback at the end of a clerkship. And in that study, we found the following domains about the students, namely student as a physician in training, student as a learner, and student as a team member, and student as a person. And this highlights that both surgeons and students don't necessarily see each other in their sole individual roles as a teacher and a student, but again, as integrated roles as person and as a physician, either in practice or in training. Now, the limitations of our study, it is of course based on written language alone, and it is open to variable interpretation. And it also excludes the ideas of those students who chose not to comment. And of course, the context, we were looking at undergraduate surgical education, but the domains that we have identified certainly apply outside of surgical education. So in conclusion, we have generated a framework looking at the key domains that students provide feedback on towards the educators. And we hope that identifying these kind of domains may help us to elicit feedback in the future from medical students, specifically regarding these domains, and that this kind of feedback is more of the higher quality feedback that we can give to surgeons and educators to help them improve their teaching. I would just like to take this opportunity to thank my supervisor and my graduate program coordinator for my Master's of Education, and to AMEE for the opportunity to present my research at the research papers session. And I'll finally leave you with some questions to think about that we can discuss when we meet in September in Scotland. So these are the questions that I would like you to think carefully about and that we'll be talking about at the flipped classroom session. So what are your thoughts on using student feedback to improve teaching performance? Do you think they have any value? 2, what system is currently in place at your institution to elicit feedback from students? And how is the information gained from this feedback subsequently used? 3, what do you think constitutes high quality feedback? Are there better ways of obtaining higher quality feedback from students? 4, what are your thoughts pertaining to the person domain that both supervisors and students comment on? Is it an important facet to consider in teaching performance? And 5, another important element that we haven't adequately explored is the culture and mindset of physicians and teachers towards student feedback. What do you think is the current culture or climate towards the utility of student feedback? And more importantly, do you think that this needs to be changed? Thank you.